for all the questions that have been submitted prior to the webinar. So if at all you have any questions, please feel free to keep adding them in the Q&A section as we go along. So we have one question that we received previously. If we submit ISO 13485 certificate, would that be sufficient or will there be an audit by CDSCO? Shravan, can you take this up? Shravan, you're speaking on mute.
Yeah, thank you, Indija. Although ISO 13485 certificate is not mandatory for obtaining a medical device manufacturing license in India, having an certificate can significantly reduce your audit burden. Without it, you will need to undergo a comprehensive audit equivalent to an ISO 13485 stage 2 audit. Therefore, as an auditor and CDSCO reviewer, I would suggest it's advantageous to obtain a ISO 13485 certificate before submitting your manufacturing license application.
Thank you, Shravan.
Yeah.
So we have another question. We have a Class B medical device and is proposed to be imported by a distributor in India. We have agreed that the distributor would affix the label. Is this allowed as per Indian medical device regulations? And how do we manage regulatory compliance in this case? Sushma, can you take this up?
Okay, sure. So yes, the India specific label can be affixed in India at the port office. So your distributor or the importer, whoever is importing your devices, they can affix this India specific label with the importer details or the MRP details at the port office, and they can clear the customs there and then stock up their devices in the warehouse. But this activity has to be taken care at the post office only, or at the customs port office only.
We have another question. It is from a SAMD developer. Do SAMD also require an IAA? Again, Sushma, can you take it up?
Sure. Okay, so even though a software medical device, it's not a physical medical device to import it and sell in India. But however, all the rest of the Indian authorized agent obligations remains the same. Like you have to file an application for import license to CDSCO. You'll have to liaise with CDSCO with the to and fro questions they might have, and you'll have to comply with all the post market obligations as well. So that is why it is mandatory to have an Indian authorized agent even for a software medical device. But you will not, the Indian authorized agent will not have the obligation of importing the device or any customs clearance or the or any direct labeling of the device need not be done by the authorized agent for the software. However, it is mandatory to have an authorized agent.
Okay, so we have one more question. We are a medical device manufacturer based in India, and all the medical devices manufactured at our site are exclusively meant for export purposes. Is it sufficient to get an NOC from CDSCO and a neutral code for medical devices without obtaining a manufacturing license? Shravan, can you take that up?
Yeah, sure. You don't need a manufacturing license for just exporting. However, you will need to obtain no objection certificate for that from CDSCO and a neutral code for medical devices. In addition to that, you must have import export code or IEC code, which is mandatory for all exports and imports.
Thank you, Shravan. Yeah. We have one more last question. For sterile medical devices, should the labels include date of sterilization as well? Sushma, can you take it up?
Sure. Okay, so if your device is a sterile device, that should be clearly said on the label that your device is sterile, and sterilization date is not required on the label. Only the manufacturing date and the expiry date or the shelf life of the device has to be there on the label as per the requirements. The sterilization date is not mandatory on the label.
Thank you, Sushma. I think we are past the scheduled time, so we'll limit the Q&A session. So if at all anyone have any questions, you guys can drop it. You can also mail us after this session to info@hchealthcare.com. And before wrapping up the session, I would like to briefly talk about what HC Healthcare does. HC Healthcare is a ISO 13485 certified company. We have all the prerequisites fulfilled and can act as your Indian authorized agent. We offer comprehensive training services on critical areas such as QMS, risk management, usability engineering, labeling, and many other topics. We also specialize in establishing QMS systems tailored for your processes carried out at your company and very specific to your devices, whether it's a simple device or a complex medical device or it's an SAMD. We are there to help you out. Our certified team can conduct internal audits and guide your company towards full compliance. We can prepare you for the CDSCO audit. We can perform mock audits, which help you in avoiding any observations from the official auditors. And we help in developing essential device documentation such as design history files, risk management documents, plant master files, site master files, and many other documents. Also, we help in getting necessary regulatory approvals from US FDA, CDSCO, EU MDR, and TGA and Health Canada for medical devices of any risk class. And lastly, but importantly, we can also be your partner in running clinical trials on the Indian population. We have proven track record, have delivered many clinical studies successfully in the past, and we are currently conducting many clinical trials too. So, with that brief talk about what HC Healthcare does, now we want to wrap up the session. I want to express my gratitude to everyone for their thoughtful and active participation. And our learning doesn't end here. Feel free to reach out through email or any of our social media contact if you have any further inquiries. Thank you, everyone.
Thank you, everyone.
Thank you.
Have a good day.